Many guys don't like to talk about their personal health issues, especially something as private as testicular cancer. But high-profile patients such as cyclist Lance Armstrong are busting down the stigmas. Now more young men are discovering it early, beating their cancer, and moving on with their lives. Everardo and Teresita Legaspi had been married a short 3 months when their lives suddenly changed.
And I remember him walking up to me and he was kind of shivering, shaking, and cold like he had seen a ghost, and that just, my heart sank.
27-year-old Everardo had just seen his doctor and received some startling news.
Once a year I would go for a checkup and everything always came out fine. My cholesterol was low, everything was fine, so there was no indication that anything was going on wrong, when I guess there was. At the time I just didn't know.
Everardo had testicular cancer. This year alone, more than 8,000 American men will likely be diagnosed with testicular cancer, which can be highly aggressive. But you're about to see that many men, maybe even most, can be cured. There are 2 keys to success. The first is being aware of your own body. While bathing in the shower, Everardo found a lump, a growth on his left testicle that hadn't been there before.
This is a rather small lump. You have to check rather carefully to notice it.
At the time, the word cancer didn't even enter his mind. Everardo went on with his daily routine, hoping the lump would go away. It didn't. Teresita insisted that he overcome his anxiety and denial and see a doctor.
I remember waiting in that waiting room and it seemed very, very long. I don't know how long it was. I lost track of time.
The second key to success? Speak up. Tell your doctor about any changes you detect.
You know, if it's about your health, you can't be ashamed of anything.
After his exam, Everardo was referred to Dr. Daniel Yao, a urologist specializing in oncology.
I honestly wasn't too sure what oncology was, so I looked that up on the internet, and that's when I found out that it was a doctor that deals with cancer patients.
Dr. Yao gave him a series of tests, blood work, and an ultrasound, which confirmed Everardo's cancer.
Yeah, testicular cancer is a little unusual in that it's the most common cancer that we see in men between the ages of 15 and 35. So it's actually a very, very young age group that is affected by testicular cancer. And these are patients that are men that are really not thinking about cancer. They're thinking about, finishing school, finding a job, starting a family, that type of thing.
But Dr. Yao is encouraged by high-profile patients who are generating new awareness.
Lance Armstrong, who had very, very extensive cancer spread throughout the body, was treated with chemotherapy, surgery, and has done extremely well, obviously.
Champion cyclist Lance Armstrong has been intent on helping men to recognize the signs.
Live strong.
A lump, an unusual firmness or swelling in one testicle that may or may not be accompanied by pain. And as more men spot their tumors and speak up, more are stopping their cancer before it spreads into the blood.
So that's what I felt when I...
That's what you felt, exactly. So when you felt your testicle, that's what you felt right there, was that lump.
From what he could tell, it hadn't spread that much yet, so he was optimistic as far as it not having been spread to other parts of my body.
Obviously, there's some calcifications here.
Everardo's tumor was operable, but that would mean losing his left testicle. Even with innovations in treatment, there was still a chance that his ability to father children could be affected. So, as a precaution, Everardo banked some sperm before his operation, just as many men, including Lance Armstrong, have done.
With the very, very effective chemotherapy, with the very effective surgical treatment, and also radiation in some patients, we've been able to essentially cure a lot of these patients.
Dr. Yao tailored a radiation therapy program for Everardo. The goal? To target and kill any remaining cancer cells.
It's been a roller coaster, ups and downs. There's good days where, you wouldn't be able to tell that anything's going on in his life, and then there's other days where he's just like sick in bed where he can't even get up from bed.
But it is getting easier. And now, Everardo has just received news that patients with other types of cancer don't often get to hear.
The likelihood that you're essentially cured is very, very high right now. It is satisfying to tell a patient who has cancer that you're most likely cured.
Tomorrow's my birthday, turning 28.
With renewed appreciation for life and for each other, Everardo and Teresita have decided to plan a second wedding.
I just feel like, the world's still out there for me to go get.
And this time, the bride and groom really plan to do it up.
And it's going to mean that much more to us, that being together and knowing what we've gone through. Maybe not the rest of the world will know, but me and him will know that we've made it.
Today, the survival rate for patients with early-stage testicular cancer has soared to 99%. Doctors are sharing the message with all men that performing self-exams is critical.